Personalities and guests alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency, and we are servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am super excited today to introduce Dr. Rian Pillitteri at Splash Hydration and Wellness right here in Boca. The address is 6877 Southwest 18th Street, Suite H121, and you can call them at 561-672-1438, and you can check out their website, www.ivsplash.com. Thank you for coming to the show, Dr. Pelleteri.
Thank you so much, Louise.
I'm super excited to delve into this whole IV hydration because I am a huge fan of all this.
Okay.
But real quick, can you just tell us a little bit about your background and where did you study and your education and whatnot?
Sure. I graduated from Cornell University in 2003.
Nice.
And then I went on to medical school at UMDNJ New Jersey Medical School, which is now Rutgers Medical School.
Good one.
I graduated in 2007. Then I went to Drexel University College of Medicine at Hahnemann Hospital in Philadelphia for residency in emergency medicine. Graduated in 2010.
What made you want to become a doctor?
I like to help people. I like to make people feel better. I just really want to make people feel better and healthier and happier.
I love that. That's amazing.
Thanks.
So what was the pivot from when you were doing, I guess you were doing traditional medicine and you were in the, where were you working?
I'm an emergency physician, and I'm still an emergency physician full time.
Sure.
But one of the things that we see in the ER a lot are people are dehydrated. Like the very, very sick people are dehydrated. People with a simple virus are dehydrated. And a lot of what we can do in the ER, we can do with IV fluids and anti-inflammatories, anti-nausea medicine. And I started thinking to myself, why does this have to be done in the ER? Why do people have to wait 5-6 hours to get an IV bag of fluids? Or sometimes they don't even get it because they don't need it per se, but it would make them feel a lot better. So I took that concept into another location, a more comfortable environment. Why can't you get an IV in a massage chair, let's say? Well, with a physician or a nurse right there with you. I mean, we know what works for viruses. We know that people feel better with fluids. We know that they feel better with vitamin C and zinc. So why can't I do that in a more comfortable environment? So that's when we started IV Splash.
That makes perfect sense. And it's so funny you say we know what people need when they have viruses. Just a quick story. A couple of years back, my kids had COVID and their girlfriends, and they all quarantined in my house.
Okay.
And I was taking my vitamins and eating healthy, and I was like, I'm not going to get sick. But I think like 4 days in, I was like starting to feel a little off, and I said, I'm going to get an IV drip.
Okay.
And they came to the house, and they had, can't remember all what was in it, but they gave me the kitchen sink, and I will tell you, I felt better right away, and within 2 hours, back to normal, like even better than normal. I actually had energy.
That's amazing, and I'm surprised at how fast people can get better with IV fluids and vitamins when they're sick as well. I'm seeing the same thing in my med spa. People will come in with viral symptoms, and no matter how long they've had symptoms for, whether it's a day or 2 days, or it's 2 or 3 weeks, they're like, I'm just not getting better. What can I do? We know vitamin C and zinc have been proven to be effective against viruses, and they're much better IV than by mouth. So you add those to some fluids, some B vitamins, and people feel better. Some people feel better, like you were saying, by the time the IV is finished. Other people, it's a day or two, but it's much faster than doing nothing.
Absolutely. And I feel like more and more people, this is becoming a little more mainstream. People are seeing it more. I feel like people are becoming more aware of the benefits of the IV therapy. Another quick time, if I could share with you,
sure.
I did a, I don't know what kind of magnesium, but I was in a lounge chair doing the magnesium drip, and I was in almost bliss. I was like, oh my God, I was totally meditating, quiet the mind, super relaxed.
Magnesium is great for that. So yeah, we're learning. We recently learned that magnesium works really well for headaches. But we know that I'm talking about IV magnesium, by the way. Magnesium by mouth will relieve your constipation, but that's about it. Magnesium IV is a lot different. It relaxes your brain and your muscles. So it's a great adjunct, I guess.
Because there's so many different magnesiums, right? There's this, like you said, the one for, to help you go to the bathroom. There's so many different, there's other ones for the brain, the magnesium L-threonate and all these different ones. So whichever one that you have, I would say people get, if you're stressed or have a headache, that for me was amazing. What are some of the other, if you can share with us, what are some of the, like, do you do the glutathione? Can you share with the audience a little bit more about what the glutathione would help benefit?
Yeah, I mean, glutathione is an excellent antioxidant, and it kind of, people always say it detoxes you. I mean, what it does is it takes metals that are not supposed to be there and gets them out of your body. And it does a lot of other things as well. But yeah, it's just another way of staying healthy. That's in my immune boost as well. So everyone that's coming for viral symptoms, I add some glutathione into it too.
Oh, nice.
As well as B vitamins, B12 for energy. We have other things. We have so many things. I mean, you name it, if it could be IV, we probably have it.
Amazing. What about D3? I know I talk to a lot of people, and I'm like, oh, I live in Florida, I get vitamin D all the time. And really, I feel like a lot of us are deficient and they don't realize it.
So many people are deficient in D3. And I'm not sure exactly why the reason in Florida it's so prevalent. Maybe it's people aren't going out in the sun because it's too hot.
True.
Maybe it's just you're just not taking in enough vitamin D. But I think just as we get older, our body just doesn't produce or keep the vitamin D3 for as long as it did when we were younger. So we do have D3 injections at IV Splash.
Nice.
And just anyone can get them. You just have to, that's one of the things you have to be careful you don't take too much of. But it's very rare to take too much vitamin D3. So as long as you're not getting it anywhere else, you'll be okay.
Right. So what are some of the other fluids that you do? Like, so if I were to go into your location and I'd say, oh, I don't know what to do. Like, what would you suggest? What would you have a consult with me?
Yeah, I definitely would. I mean, the first thing I would ask is, are you having any symptoms today?
Okay.
Because a lot of people are having pain. And if you're having pain, I do have IV Toradol, which is like ibuprofen. It's going to relieve your pain pretty quickly, but I'm not going to promise it's going to relieve your pain forever.
Sure.
So we have other things that can help. We have an infrared sauna that can help.
Oh, I love the infrared.
Infrared is great for muscle pain.
Yes.
I didn't realize how good it works until I started doing it myself.
Yes.
You go in there with a little back pain or whatever, you come out and like all of a sudden you're like sitting up straighter and everything's just a little more relaxed.
Nice.
Yeah, so that's another nice thing that we have.
And good for the wrinkles. Like I heard it helps boost collagen production. So it would be good if you get it on the face or wherever you have wrinkles, right? Yeah,
infrared is the opposite end of the spectrum as UV. So I like to say it kind of undoes the damage that UV does. Infrared actually helps your cells repair themselves. So it is very good for your skin.
Nice.
That from for sun damage for your skin, infrared can help with that. It helps with hair growth. So yeah, that's a nice thing that we have as well.
Nice.
I mean, and that's just the beginning. I mean, we also have NAD if you're worried about aging.
Tell us about NAD.
NAD.
I hear it all. I see it all the time on the internet. I'm
know.
like, okay, and then I forget. I remember and then I forget. So please remind me. What is
Sure.
What is NAD?
NAD. It's very hard to talk briefly about NAD because it does so much. But I'll do the best that I can. So I mean, it stands for nicotinamide adenosine dinucleotide. That's just the molecule. It's the molecule that transports energy to all the cells in your body.
Okay.
So it's in all your cells, and it's in your bloodstream. It's all over the place. Everything that you eat, drink, when it gets broken down, it's to activate your NAD molecules. Okay, these activated NAD molecules transfer the energy to your cells. as we get older, unfortunately,
I knew you were going to say as we get older.
I said
It's
we.
true.
I said
no,
we.
I know.
Our NAD levels are going down.
Right.
They're going down every day, every month, every year. That's why
Right.
kids have so much energy to run around all day, and we're like, I'm
Yeah.
not going to do that.
Right.
IV NAD makes a huge difference. You'll feel, most people say they feel 10 to 20 years younger after an IV dose. Yes. For me, I feel I can go into an ER shift in maybe 10, 11, 12 hours. By the time I'm done with the shift, if I've done NAD within a week, I finish the shift about the same as when I walked in.
Wow.
You're not hyped up on energy.
No.
You just have the energy to do the things you used to be able to do. And then you can sleep well too. So people are using it for anti-aging. They're using it to help their brains function better because you are more alert,
Right.
more focused. Just like everything is easier.
So how often do you think one should do, what would you recommend, how often if one wants to maintain those levels of energy, how often do you suggest they do an NAD drip?
And that's a great question because there's a lot of different answers to that.
Okay.
I really think it should go by how you feel.
Okay.
But in general, I would say once a week. And then you'll figure out what dose is right
Right.
for you because
Right.
you'll know when it wears off.
Oh.
Because you'll be like,
oh, yeah.
wow,
Yeah.
I don't feel like I did last week.
Right.
So
Right.
yeah.
Okay. Good to know. So, what are some of the if someone wants to come in for maintenance, what for energy and anti-aging? What do you alternate? Do you say maybe we'll do this one week, this another week? What would you?
I would keep doing NAD.
Oh,
That would
keep
be the
doing
first thing I
NAD?
would do, NAD.
And you can mix that with the other.
You can use infrared.
Okay.
I would do the infrared for the superficial things.
Right.
And your muscles as well.
Sure.
And then I would do NAD kind of for everything else, to make your brain younger, to make your spirit a little bit higher.
Nice.
Yeah, I know it's.
I can't wait to
excellent.
go. I'm ready to go. How long is the process? How long does one have to expect to take? What
So
time to time?
It depends on what you're getting. Most IVs can be done in less than an hour.
Okay.
NAD for most people is less than an hour, but I say plan for 2 hours.
Okay.
Just in case.
Yeah.
But
Sure.
yeah, about an hour. You can be in and out.
Nice.
Yeah.
So, what else can you share with us? I don't know. I'm here
Yeah,
just talking away.
I mean, that's not even everything. We have an oxygen bar as well.
Oh.
There are not too many oxygen
wow.
bars in South Florida.
That is right. I've tried
Yeah.
that too. I like it.
So
I love
yeah,
them.
yeah. Oxygen will help you. It gives you a little bit of energy. It helps you focus a little more,
Yes.
and it helps you feel better. We put essential oils in with the oxygen.
Oh, I love
So
that.
you get the effect of the essential oil plus the oxygen at the same time. So it smells really nice.
Oh,
It looks really cool too,
nice.
and you feel better.
So, if I were to go, do I have my a place where I can kind of relax and have like privacy, or what? Will give us an idea what it.
Well,
type
you'll
of
have to come in for a
experience.
tour, Louise.
Okay, I will.
Yeah, because we have massage chairs. So we have full body massage chairs that you can sit in.
Nice.
Just to get a chair massage, or you can get an IV while you're in the chair, and that's totally fine.
Oh,
Yep.
Yeah, nice.
The oxygen bar has 4 separate chairs. That's a separate area. And then for the IVs, yeah, I said you could do the massage chairs. But we also have we have a lounge area, or if you
Okay.
want to come with your loved one and hold hands.
Okay.
There's there's like love seats in it. If you want to bring a group, you can all sit together. We have a TV you can watch, and all
Very
hang out and get
nice.
IVs together. But then there's also semi-private rooms if you
Okay.
don't want to be seen
Sure.
in a group. You want to just be left
Be
alone.
alone,
We
yeah.
can put you over there.
Okay.
So it's pretty big. And then the infrared saunas on the other side.
How long does one do the infrared sauna? Is it like a tanning booth bed, or what is that like, or is it like a?
No, it's a small booth that you sit in.
Okay,
Yeah.
got it.
And you sit there for 25 to 30 minutes.
Do you have to cover your eyes?
You don't have to cover your eyes. You can bring your cell phone
Oh.
in. It doesn't damage anything.
Nice.
It's good for everything.
That's so amazing.
Yeah, and it's 25 to 30 minutes. It's not as hot as your usual saunas. So it works fine at 105 to 110 degrees. So you don't sweat so much, but you come out feeling good.
Yeah, and I heard that that infrared sauna is really great for detoxing, right? Is that right?
For detoxing.
For like for sweating or like or
So,
no?
so detox is a strong word.
Yes, so
Um,
please correct me. So what is it? What else does it help? Or what would be the best for detoxing?
So it depends on what you mean by detoxing. So it will undo damage to your skin.
Okay.
And so the far infrared sauna that we have,
Yes.
it goes deeper through the skin into your muscles and helps the muscles relax themselves.
Oh, okay.
Yeah, so I've seen like patches that people are selling that are very similar to infrared.
Okay.
And what they're doing is kind of reflecting the infrared from your own body back to itself and letting it
Interesting.
repair itself. It's the same concept.
Huh.
But yeah, you can do that with infrared. It'll go straight into deep into the muscles, and you just come out feeling relaxed. And you wonder why, because you can't see the light.
Right.
It's invisible, but you
Oh,
come out
yeah.
feeling great.
That is amazing.
Yeah.
So can you talk about compression therapy and what is that about?
Sure. Yeah. We also have compression boots.
Actually, you know what? We're going to take that question when we come back. We have a commercial break, so we'll talk about that as soon as we come back. Sorry about that.
Okay.
We'll be right back,
Sure.
everybody.
Thank you.
Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back in. We have Dr. Pillitteri right here in Boca Raton. He has Splash Hydration and Wellness at 6877 Southwest 18th Street, Suite H121, right here in Boca, Florida, 33433. The number is 561-672-1438. And the website is ivsplash.com. So we were talking about the compression therapy, I believe.
Yeah, the compression
What is
boots.
that about? Oh, tell me about that.
So they're designed to prevent blood clots. The people that are using them are probably not using them for that purpose necessarily. They're using them because they feel good. So what it does is it's airbags that compress your feet and then your calves and then up your legs.
Okay.
It feels really nice. A lot of athletes use them, especially after a workout,
Okay.
because it relieves their aches and pains.
So what does one experience? Like I would put my feet in and I'd feel the compression getting
Yeah.
Almost like a cuff, like a
Similar to a blood
Similar
pressure
to a blood
cuff,
pressure
but you
cuff?
can control the pressure, so it's not
Okay.
going to
It's not
squeeze
gonna
you
be
that
too-
bad,
okay.
unless you wanted to.
No, I got it.
But yeah, and it compresses from the lowest part to the most upper part, so that way it's to prevent blood clots from forming down lower and continuing the blood flow back up to the rest of your body.
So who would be at risk for a blood clot?
People admitted to hospitals, in particular,
Okay.
people after surgery.
Okay.
But again, I'm not suggesting you come to IV Splash for that reason. Those things should be covered by insurance if you
Sure.
need them.
Absolutely.
If you're coming to IV Splash for the compression therapy, it's because you want to feel good, you were relieving the aches and pains in your
Sure.
legs, or you're doing it while you're getting an IV because it feels nice.
Or I sit all day for my, I work from home. I sit all day basically. So
I mean-
I have to get up and get down and up and down. So I feel like someone like me would benefit
Yeah.
from those compression.
You can come in and put the boots on and
Yeah.
do your work while you're while
right?
you're getting
Yeah,
your
because
legs massaged.
I feel like I would benefit because it would help like activate that blood flow, I guess.
Yeah, it would. It would help.
That would be amazing. I'll definitely want to try that.
Sure.
So I know you have a couple of other therapies.
Yes.
What else? What are we missing? What
All
else
right.
do you
Well, it is February,
have?
and Valentine's Day is coming up. So we do have what we call a passion potion.
Oh,
Okay.
okay.
Yeah.
I like that.
So that is what it is. It's an amino acid blend. So amino
Okay.
acids are the building blocks of proteins. There's 4 of them in particular that, when given IV, will help increase blood flow in the same way that Viagra increases blood flow.
Oh.
So
Okay.
couples or singles can come in and get an
Nice.
IV drip of the amino acid blend.
Nice.
And what I've been told is they get it on a Friday usually, and then they have a very good weekend.
Okay.
And then they're
good
thanking
to
me
know.
on Monday.
See, that's really good to know for our listeners because, you know, what you're offering, there's so much that you offer in your one location. It's
Yeah.
just,
Yeah.
it's a great menu of offerings.
Yeah. And we haven't even gotten to the most popular, or first or second most popular thing at Ivy Splash, and that's weight loss injections. It's a hot topic now.
Sure.
They just came out with a study that showed that reducing your weight from an overweight level to a normal level reduces your risk of heart disease by 20%.
That's amazing.
So
Yeah.
it's huge. And I know that the weight loss injections have side effects.
Oh, you're talking about like the Ozempic.
I'm talking about,
I know someone
yes,
personally who got very sick from that.
semaglutide and tirzepatide, which we do offer. And again, I was very worried about it at first.
Okay.
Until I see the effects and all the good effects it has. The other thing is, so I'm an emergency physician.
Okay.
Okay,
Yes.
so I've seen the worst of the worst. I've seen what the worst thing
Right.
can happen is.
Right.
I feel like if you're doing these medicines the right way, you're being supervised by a physician, you're not going to end up in the ER.
Okay.
And
Good to know.
another thing that we offer that nobody else does is if you're getting semaglutide or tirzepatide at IV Splash, and you do have reactions, if you're vomiting,
Sure.
you can come in and we'll give you IV fluids
Right.
and Zofran for the nausea at no cost. Okay, because I would rather see you myself,
Right.
take a look at you and see how you're doing, than have you
Nice.
sit in a waiting room for
Yes.
5-6 hours and hopefully get what you need.
That's amazing. So
Yeah.
you'll offer that. So anybody who's interested, you're going to get like a whole gamut all in one location. You'll get the
Yeah.
injection, and then you'll also have
You have that safety net. That we
safety
have
net.
IV fluids and Zofran if you need it.
correct.
So
yeah, that's good.
because again, I want to take care of people.
So what about a splash? Not an Ozempic, but what about like a splash or an IV bag for weight loss?
Okay.
That I'm interested in.
Yeah. So, IV for weight loss. It's hard to really say for sure that anything directly gives you
Sure.
weight loss. But what does help is NAD, which we talked about
Oh, okay,
before,
good.
because you have the energy and you're doing more, and you end up losing weight secondarily.
Makes sense.
Same with B12; it gives you a little bit of energy, and you'll do more, so you lose weight secondarily to that. We do have another injection that's very safe. It's our fat burner injection. It's 2 amino acids and 2 vitamins. It's just an injection. It's once a week, intramuscular.
What are
There's
the amino acids?
methionine,
Okay.
inositol, choline, and B12.
Okay. Nice.
Yeah, so one is to burn fats and turn it into energy. One burns carbs and turns it into energy. One relaxes you, and one gives you energy. So altogether, it's an
like that.
appetite suppressant, and no one's had any side effects of that other than their food bill goes down because they're not eating as much.
Right.
You don't have the dramatic weight loss that you do with the other medicines,
Right.
but you also don't have the side effects.
I like that because
Yeah.
it's a natural, the amino acids,
Yeah,
because
it's all things that your body
all
has in
things that
you
we
anyway.
have in us anyway, and you know, a lot of people don't have the opportunity to actually burn fat. They're actually just keep burning the sugars or keep burning,
True.
right?
And it's very hard to lose weight.
Yeah.
It's just, I mean, there are some very, very dedicated people that
Sure,
can do it.
absolutely.
But you know what today is like, and you know how busy everybody is, and it can be hard. So the medicines and even the lipo burner injections just give that people the extra boost.
I feel like
So
that's
you-
like a jump start.
Exactly. Yeah. Like you still have to do the work. You still
Yeah.
have to actually eat less.
Yes.
But you will feel full faster, and you won't want to eat as much. So it makes it a lot easier.
Yeah, it kind of all goes full circle because you get more energy, you lose weight, you eat less. So
Exactly.
it.
Yeah.
Oh, that's amazing.
Thank you.
Do you have any I don't know, maybe success stories of anybody who's lost weight or whatever situation? Can you share with us?
Sure. Without mentioning names,
Of
yeah,
course.
there's definitely one client that's been very successful on semaglutide at Ivy Splash. She's been doing it for about, I think she did it 4 or 5 months.
Nice.
And she got to the weight that she wanted to be.
Nice.
Yeah, so, and she went from overweight, which was unhealthy, to normal weight, which is very healthy. She's happier, she's smiling more.
That's
She's
amazing.
more confident. She's super happy. I mean, she's like, she always comes in and thanks us. Now that she's at the weight that she's, a question that comes up frequently is, what are you going to do when I get to the weight that I'm at? If I stop, aren't I going to gain the weight back? The answer is everybody's different, so I can't predict
Sure.
that.
Sure.
But what I've been doing is I've been weaning the dose down
Ah, okay.
and checking their weights every time that they come in and just seeing how they're feeling.
Nice.
And then for maintenance, I've just been using the lipo burner injection because it's safe and effective.
Absolutely. We actually have 1 minute left. This has been
wow.
going really quickly.
Okay.
But yeah, if you, with the last minute we have, what would you like to maybe share with our audience, our listeners? Any type of call to action or whatever you'd like to share?
Yeah, I mean, so it's February, which means it's the season for viruses to be coming around. So if a lot of people come in because they're exposed to a virus or they're starting to get symptoms, so why wait when we know their vitamin C and zinc and fluids are effective? Come in, see us at Ivy Splash. Let us take care of you.
I will see you there. Thank you, everybody, for tuning in. And we, again, at All County Healthcare are servicing Palm Beach County, Broward, Miami-Dade. You can reach us at 954-717-7027. Thank you for tuning in. We'll see you next week. And thank you so much for coming to
you,
visit
Louise.
us.
Thank you
I
very much for
appreciate
having
it.
me.
Absolutely. It's been great.